Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great exercise, the plate squat for spondylolisthesis. Hope you enjoy. So one of the themes with spondylolisthesis exercise is to help you avoid pain and to heal your condition that we've covered in many videos before on this channel, is the avoidance of an excessive arch in the lower back or lordosis in the lower back. Many times that's complicated by a tendency to have an anterior pelvic tilt where people will have the pubic bone lower in position than the tailbone in the normal standing position, which increases the arch in the back, and that compresses the back portion of the disc as well as the facet joints, which many times are aggravated in spondylolisthesis because as that bone travels forward in spondylolisthesis, it has a compressive effect on the back portion of the spine. If you've taken any of our videos before on spondylolisthesis to heart and learned your unique posture and mechanical issues, if you've learned your neutral spine, which is your safe position, then you're ready to go with this exercise. If not, I invite you to go to either the Pain Free and Fit or Posture Size websites. We have a free body analysis there. Please take that analysis. Learn if you have a tendency to have any postural mechanical issues that's aggravating your spondylo, such as a tendency to lean your rib cage to one side or to hike one hip up, which compresses one side of your spine and overstretches another. Many times patients will also have problems where they will have a tendency to rotate their pelvis more strongly to one side with an asymmetry in their oblique muscles or their torso to one side, or have an anterior posterior pelvic tilting posture. You need to know all these things in addition to weak core muscles such as multifidi malfunction and abnormal internal oblique and transverse abdominis function. Once you've digested all this and you've learned what your neutral spine or safe position is and what movement tendencies or posture tendencies to avoid, then you're ready for this exercise or any other exercise. So for the plate squat for spondylolisthesis, we're going to be taking the concept of squatting, which is moving from the hip joint as we hold a neutral spine, allowing the ball and socket to rotate as our pelvis rotates forward but doesn't change its relationship with the spine. And we're going to take our normal squat where we were holding dumbbells in our hands, and we're going to change that to holding a weight plate at our belly, at our chest. When we hold a plate, it has the tendency to engage tight against our lower abdomen. It has the tendency to engage our latissimus muscles, which run from our shoulder down to our lower back. And the latissimus muscles naturally want to arch the lower back. So this creates more of a challenge for us to resist that by contracting our abdominal muscles strongly as we perform the squat. The other thing that happens is the higher the plate goes on our body, it's going to recruit more of the erector spinae muscles, those muscles that run up and down the sides of our spinal column, which have, remember, fibers in the lower back section, which are very good, like the longissimus and the iliocostalis, at holding that spondylolisthesis backwards. They exert a retrolisthesis or a posterior translation stress, which is healthy for spondylolisthesis. But the higher thoracic fibers of iliocostalis and longissimus, they have a tendency to extend our spine because they pull the thorax backwards and help to increase that arch in our back. So between the lat and those upper thoracic fibers, the higher we hold that plate, because we're increasing the moment arm or the lever from our center of gravity upwards as we squat, we're going to be engaging both of those muscles very strongly, and it creates a great challenge as we go through our squat. Now, most of you don't want to start with a 45-pound plate. You want to start with perhaps a 10-pound plate or a 5-pound plate. Begin by holding low on your body, and as you make progress over the weeks and months, slowly slide that weight plate up. It's more important to work on the lever arm first before you increase weight. That tendency to extend the spine because you're keeping your shoulder blades together and pulling the weight in, that's engaging the latissimus. And the higher you go, it's increasing the thoracic erector spinae involvement. That's going to be compensated for by good abdominal tension. It's training your abs, integrating abdominal function with glute, hamstring, and back function to hold you steady as you squat. And as you make progress, you can increase the weight. Again, whenever you increase weight, you're going to start low with the weight right above your thighs. And as you make progress, that weight will change where it comes up further onto your chest, making this a great spondylolisthesis training exercise to resist extension and aggravation to your condition. If you like this exercise, would like to learn more, feel free to subscribe to our channel. We got a lot of great exercises on spondylolisthesis. If you're looking for a program to customize a exercise program that accentuates the healing stimulus to your spondylolisthesis, helps you learn all the stretches, coordination, strengthening, and pain relieving exercises, go to the painfreeandfit.com website. We've got a great spondylo program there called the Fast Track Healing Exercise Program for Spondylolisthesis. If you have any questions or comments, please leave them. I'll do my best to get back to you. I hope this exercise, plate squatting, helps with your spondylolisthesis.